My name is Irene Ntebel Muti. I am a massage therapist trained in the United States of America in the state of Delaware, certified nationally and licensed in the state of Delaware. I started doing massage in the year 2009. I have practiced in the United States since that time up to 2013. I worked with chiropractors, medical doctors, pain management doctors, and surgeons. That was my last appointment that I had before I relocated back to Kenya. We are located in Current Park, that is on Gong Road. If you're coming from Nairobi, it's just before you reach the Current Shopping Center. It's called the Current Park, Suite 18, opposite St. Christopher's Secondary School. I knew that I had a touch for people in the 80s. I had an experience of holding a child of my neighbor who had passed out, and I lifted him up and I just held between the breastplate, and the child started breathing. My services are offered to not everybody, but to most people who have chronic pain. If you have soft tissue pain, musculoskeletal, you have low back pain, you have shoulder pain, you have knee pain, you have leg pain, you have been injured, maybe you had an auto accident many years back or even a few years ago, you need to come for a massage. We need to relieve that body of those memories. We hold our memories in our muscles. We also work with people who have had surgery. If you have had a surgery and you never got rehabilitated, chances are you actually healed that wound and you have a shortened muscle because the collagen was not broken. You have that scar tissue that is still growing. We need to work on that. The physiology or the anatomy is quite important. When you work with the body, the knowledge of which muscles or what group of muscles you're working with. I give people 4 sessions, 6 sessions, up to 12 sessions. And it's not only massages, because I stretch people, I give you your home care. So it is actually, you take responsibility. I don't want you to be dependent on me, and I don't want to depend on you. So it's a two-way thing. If I give you a home care, which I tell people you need to stretch. If you have a pet, look how it does. It sits, it stretches. You need to stretch yourself. Let's talk about people's postures. We have different postures. The way people sit behind a computer all day. We have people who are texting with modern ways of living these days. The way people sit in their autos or in the cars when they are driving. We also have cases whereby people, the gait is not right. Gait meaning the way people walk due to their postural issues. We have also cases whereby we have structural issues. People who are just born the way they are. We try to work with the soft tissue injuries, the compensatory issues that arise. If you have somebody who is sitting behind a computer and they have their shoulders forward all the time, the neck is extended, you have a cervical issue. You have these people coming with headaches, they have shoulder pain, they have neck pain. It's just a matter of actually putting that person or putting that neck in a position of ease. We call them positional release. And it is very easy to know which muscles or which group of muscles you are working with. Most shoulder pains are also caused by the subscapularis. That's a shoulder that is on the scapula. We have also little muscles called the infraspinators and the supraspinators. If you're not aware as a massage therapist, if you do not know your muscles, there is no way you will work properly. It's not just a matter of grinding. We have techniques. You have to strip those muscles, you have to stretch them, you have to pin and stretch. One thing that I encourage my clients when I'm working with them, even when I'm doing the positional releases or trying to really stretch their muscles, is to take deep breaths and concentrate on their breathing. It is very, very important to do that. It is very important also to be in the moment. If you are in the moment, if you're concentrating on what you're doing and actually focusing on it instead of thinking of when am I getting home, what are we going to eat. If you just stop to think and be in that moment, you will be a very stress-free person. We have energy bodies. Everybody has those energy bodies. We try to balance those energy bodies. Some of them are overactive, some of them are not active, and so we try I try to balance that. My hands are the stethoscope. Palpation. If I touch, I can almost tell what is happening to that body. Not to mention when you walk into the door, or even the way you lie on that table can tell me a lot. You can see even how people, what people are holding by the way they lay there on the body, which side is pulling or which side is being compensated. It's very easy. We use the eye and we use the hand. Why me? I think I have the experience and the knowledge, the anatomy and physiology. It's not just the massage that you go, people have learned that through the YouTube or anything. I've talked about knowing the origin and the insertion of a muscle. You need to know how those fibers are running. I've learned many techniques that relieve pain. So a stress-free life, be in the moment, be in that moment. Whatever you're doing, whatever you're going through, be in that moment and try to tune to your body. What is the body saying to you?